Hi guys and welcome back to Scrub Mentality! My name is Frances.
And I'm Mayshin, and today we're gonna discuss to you about simple stuffs like what to bring to emergency department if you try to decide, punta tayo ng ED kasi masaya doon. Anyway, so the truth is, we are two Filipino nurses trying to share anything about healthcare, emergencies, and then the little truths about working in the hospital. And then,
So just anything that we can think of, we talk about with you guys. If you've been watching our channel, it's just really random stuff that we've experienced as nurses. So today, we're gonna talk about what are the things that we should bring and we should know when we go to the emergency
yung I wish they could
room.
have done better.
Yeah.
Yeah.
I wish, sana dinala ko to, ba't ko nakalimutan and all. So I know we are really busy as ER nurses. We have loads of stuff in our plate. But hopefully, this video will help you. Not only as nurses, but also if you're going to
As a patient, or if you've got significant other that you want to bring to the emergency department.
Yes, to make it easier for you, to make it a pleasant journey.
Yeah. Today, we're gonna try to discuss some questions that you've got before coming to the ER. So we've got some 10?
Yeah,
10
it's
topics,
more or less 10.
More or less. But yeah, so
Should we get started?
yeah, let's go.
What should you do before coming to ER? So first thing is always bring a list of your medications.
Yeah.
So it sounds very simple, but it's often overlooked by patients. You don't blame them when they come to A&E. Especially with ambulance. When you're in a rush, you don't even have a hospital bag with you. But sometimes if the ambulance people are good, i-remind ka naman na, dadalhin mo to medication. Kasi if you go to hospital and say, if we ask you in the assessment, when we're doing assessments, did you take any medicine before this morning? I just took the white pill or the white tablet, and for my blood pressure, there's loads of tablets for blood pressure that's white. So it's very important if you have a list. It will really help the nurses and the doctors.
Yeah. And also imagine if you're the risk if you're in pain and then suddenly you became unconscious and then you don't know what medications you're on, especially for those taking regular medications. We could give something that could interact to the medication that you're currently on. So it's really nice if you would bring them in handy with you. I do understand this, especially as you mentioned, especially if you're in an emergency and yung namamatay na yung pasyente mo, syempre hindi mo naiisipin yun, di ba? But somehow, if you were advised to come into emergency department, you were sent by the GP or advised by someone, it's handy if you would bring your medication list with you. And also, it saves us...
in abroad, di ba, usually, yung doctors, they will ask you talaga, what medications do you take? How often do you take them? I think they're trying to get the medications that you take at the same time. How's your regimen with your medications? In here, the pharmacists do it.
Yeah.
Have you noticed? If the patient is like going home, they have to make sure that they have a good compliance with their medication regimen. They will ask, how will you give this? What time do you usually give it? They're very specific. But having a list saves time.
Exactly,
for the doctors, you, the
Saves
pharmacists.
errors.
That one as well. So there's just a lot of things. Is there anything that you want to add about bringing any experience that
because sometimes, especially in my current hospital, for example, at 5 p.m. our pharmacy closes. So there are times that your, especially your regular medications are not available in the emergency departments. Like,
the ones in Webster PACS?
Most of it are not available in the emergency department because for obvious reasons. So sometimes, kung hindi siya available sa department, it's nice if you've got your medications with you. At least you can still take your medications on time.
Yeah. True.
Because sometimes other medications are supplied by like specific specialties, like maybe it's your chemotherapeutic drugs or something for your kidneys. It's not always available.
That's why if the patient has load of medications and they have it with them, the list. Sometimes you're lucky if they also have the picture of the tablet, so you don't have to look one by one, you don't have to guess. So it's really helpful.
Yeah. And also working here in a very multicultural country, sometimes people coming from like India, Pakistan, they've got different kinds of medicines, like different generic and brand names. Yeah, it's nice if you've got a list.
This is just easier. No?
Yeah, and yeah, that's what we mentioned, to prevent any errors. Yeah.
You don't want to double dose because like, oh, I've taken my this morning. Diba? Parang tapos, are we gonna give it? Are we sure it is? Is it not the medication or is it the medication? So it just prevents errors as well. Okay, I think that's it for that part. And
the next one will be know your allergies. Don't just say I'm allergic to this and that, I'm allergic to injections. Which one is it? It's necessary if you will inform us what's the medication itself. For example, penicillin, maybe a vaccine, or just COVID vaccine or whatever. And then it's nice if you will tell us what are your reactions. Here, when you present yourself in the emergency department, it's a necessary question to ask the allergies, and then what happens to you if you take this tablet. Because sometimes kasi sometimes it's not really allergy. That's why we would like to know if you've had anaphylactic reaction like rashes, shortness of breath, or just sometimes
nausea.
Kasi sometimes it could be just intolerance, not an allergy. So it's really necessary. Yeah.
And then sometimes as well we get confused when you say like we're allergic to this, when really you just didn't like the taste or how it was given to you. So it's not really an allergy. It's
like for example, codeine, we would ask people like, are you allergic to this? Yeah, because I'm always having constipation. So it's not really an allergy.
Codeine has a side effect.
It's a side effect of constipation. Yeah.
So true allergies really, you would know it's because you have rashes, swelling, or worst comes to worst, shortness of breath, closing of the throat.
Exactly. Yeah. And did you require an EpiPen when you adrenaline before when you had certain medications?
If you're abroad, they'll give you a red wristband. Yeah. So in the UK, it's also red. Here, it's also red. Just to like notify that you're allergic to something. So it's a good practice, even in the Philippines, to always keep the information in mind that if you're allergic into something, inform us what's the reaction. You should notify the nurses and the doctors.
Just maybe like basically simple allergies, like even dust. I know it's not a food allergy, but latex allergy, it's very important.
Latex,
kahit maliliit na bagay, just inform the nurses or
the reaction.
Any person ahead of time.
Like it was not me. Parang may isang nurse sa dati kong tetrabahoan na I think hindi niya chinek na patient pala is latex allergy. And the silicones?
Yeah.
It has
the gloves that
the gloves and the silicone itself, parang may latex. So, nagka-rashes. Tapos, parang silang lahat, hindi ko na-check na allergic pala siya. So you'll have to be careful. Even how minor, you should inform and let us know. Yeah. So I think that's it for
the allergies.
Next thing that you should bring when you go to A&E is your ID and insurance card. So here in Australia, when you book in, they will always ask for your Medicare ID.
First,
Yeah, first. That's the first thing. In the Philippines, PhilHealth naman. But I think PhilHealth is later on when you bill, yung sa billing na. But also, you can have your health insurance card because you have private health insurance here. So they ask that as well. But it makes everything smoother. Like if you've got the card, if you get the number, everything will be like,
Because I think it's all linked together here in Australia. So that's why Medicare card is linked to your MyGov. So they can see everything, all your records in there basically. And so emergency room here in Australia always treat you first, especially if it's life-threatening. But once you're stable, the paperwork matters, so they can go next to that one. But anyhow, if you're quite stable, present yourself an ED, present your Medicare card. In the Philippines, I remember once you book in, go to the payment section, pay for the emergency fee. So it's sad because they won't first
hingi pa sila ng,
I would remember because I've worked there.
Hingi pa sila, ma'am.
You would send the relatives
pera.
to diba?
May iba mag-withdraw pa, ganun, mapadala pa, kawawa. So it's really different. And not only IDs and insurance cards, GP letters, I'll just insert. Because GP letters are really informative. So usually, if they come in and they give you a GP letter, you don't have to do your assessment because it's the same thing.
Yeah.
And then your history will be there, the medications that you take will be there.
It's all compiled.
It's all easy. And in A&E, in emergency care, smoother is always faster. So we win. Your patient win, you win.
Exactly.
The faster, the better.
So that's it. Medical insurance card. So just think that it is one of the survival kit in emergency department.
If you go to ED, just shove it in your bag together with your medication list and your tablets.
Yeah, just put it in one box. So the next one will be number 4. So if you suspect that it might be a surgical procedure, don't eat or drink because that abdominal pain might suddenly trigger, and then suddenly you've got appendicitis, and then your procedure will be put on hold because you've taken something.
Yes.
It is only valid if you are known already. Like for example, you were sent by the GP and then you're known to have appendicitis on the CT scan. Then at that point, just don't eat anything when you present yourself to the ED because it might add another extra hours for your incoming procedure.
Here, when I've arrived, I can compare here when they're coming in with abdo pain, anything that can be related to surgical, or if you think that you're gonna go for a scan,
they would put nil by mouth.
Even how hungry you are. I think it's because hindi ka naman mamamatay sa gutom. But if you eat tapos may may something surgical or kailangan mo ng scan, you're delaying yourself, delaying diagnosis, delaying treatment.
Exactly.
So, there are instances na minsan yung patient talaga gutom na gutom tapos kakain. Tapos, as a result, di ba, mas longer yung waiting time niya para magawa yung procedure because of the risk of aspiration.
Yeah.
So, the anesthesiologist will need the stomach to be empty first kasi during surgery, everything you'll be on general anesthesia, so everything will be aspirate ka, which will cause you
more harm.
Which is why they're very strict when they say don't let them eat or nothing for orem or nil by mouth.
If you're unsure of if you're allowed to take or drink anything, just ask someone professional before binging with hamburgers or
But this doesn't also mean, guys, that if you go to A&E and you're in so much pain that you don't take painkillers at home.
Oh yeah.
So
it's one of my myths before, because before you remember when you've got appendicitis, they said don't take pain relief because it will mask the pain.
Oh yeah, but you should take, if you're in pain, take the medication and just tell the doctor when they come that you've taken it and that the pain was so severe and you said you will have the scan. You will be diagnosed, you will be scanned, they will do blood tests. It won't change anything. It will make you more comfortable.
I know.
I know it's just, that's right. I think it's nandun yung, gusto ko talaga i-describe sa doktor kung ano kasakit. In exchange of that, umiiyak ka na sa sakit, di ba? Just to but you can
get something.
There's other ways to relay to relay your concerns to the doctor. Don't give pain to yourself.
Don't endure the pain.
Take painkillers. Number 5, another thing is to call 911 if it's in America or in Philippines ba 911.
Meron ba sa Philippines? I'm not familiar.
We have one in Davao.
Yeah?
Yeah, we have 911.
Thank you,
proud
Duterte.
Davaoeña. Thank you, Duterte. So call 911 if it's serious. So here, call 000.
Yeah.
In Australia. And in the UK, call 999. So you know that. That's some scrub mentality. So don't try to be a hero sometimes na you're having severe chest pain and because the ambulance will take 5 hours before they come and you drive yourself to the ER. The advantages of having an ambulance being with you, especially if it's just chest pain, shortness of breath, they can do ECGs.
They can manage you.
They can put cannula, they can give you fluids.
Treatments.
Some of them are trained to intubate. Yeah. So you're in safe hands.
Yeah.
I know the problem with this comes with previous maybe bad experiences na 10 hours ako nag-wait, kaya na pa ako umaga, ngayong gabi lang dumating. So, prefer to drive,
Yeah.
no?
So yeah, what you've mentioned, because ambulances are not just transportations, we can give immediate treatment
Yeah,
for
they're really good.
especially life-threatening cases. So as we've mentioned, here in Australia, if you drive yourself, you can struggle with like maybe traffic or any
Traffic.
uneventable stuff
Tapos,
going on the
you
road.
might have accidents,
Yeah.
diba? So it's really, there's disadvantage there. Unless you have someone to drive
And
you.
also, if you call 911, even with just like simple stuffs, they can advise you through the
what to
phone.
do. Yeah.
Even if it's just a dental pain or something, because I did that one before when I
Yeah.
had my wisdom tooth. You remember? So I just called 911 because they are qualified doctors or nurses or paramedics,
Telehealth, yeah.
telehealth, that know how to manage you. They can advise you to do this and that. If
Yeah,
you-
true.
They would advise you if you need to go to emergency department, or you could just sleep it for tonight and then just see your GP maybe a day or two. So yeah, it's nice if you will give them a ring first.
Yeah. Take your advice. And sometimes, usually, they tell you naman to go to A&E or
Yeah.
call the ambulance.
Because if they wouldn't know, they will just go to A&E.
Yeah. But in the Philippines, we, like you said earlier, we have also EMS, like in Davao we have.
Yeah.
But the problem is, I'm not sure how the traffic rules are because I don't drive in the Philippines. But I think it should be I think it's international na.
Yeah.
If there's like ambulance with blue light on, you should make way. I know there's traffic and with limited EMS, emergency medical service coverage.
Yeah.
But if you have it, access it because it's really helpful. It can save lives.
The only sad thing in the Philippines, because I work in emergency there, you have to pay for the ambulance.
Yes.
And then you have to pay for the nurse who goes with the ambulance.
Yeah.
That's why when we were emergency nurses back there, we would love to go with the ambulance because they will pay you 500 peso. 500 peso is way bigger back then.
Yeah, maybe
So
years
yeah,
ago.
and the traffic rules is the same. They would make way for the ambulance to go past. So yeah, that's nice. But yeah, that's it. Number 6 thing to do when you're coming to emergency department is to bring a buddy.
Bring a buddy.
Bring a friend.
Bring a friend.
Yeah, a family member. It's not just for emotional support. It goes a long way. Imagine being like in pain and then you're alone in there, crying, no one supporting you. I wouldn't want it myself. So trying also someone who can like try to answer the questions when you're being asked, because obviously if you're in a lot of pain, you would just cry, right?
Yeah, you won't have time. You will be so irritable. Now, why are you asking questions? You have to give me pain. And also, when like, especially for like unconscious patients or confused
Can you
patients.
imagine unconscious?
Unconscious patients, if they're alone, sometimes they're alone, diba?
Yeah.
I have that experience in the UK. They come alone. We don't have anyone to ask.
You don't know the history.
Yeah, what happened. It's really important to have someone because, for example, you have a confused patient, like if you'll have someone, less nurses, you will have someone to ask, like, is she normally like this?
Yeah.
How does she normally verbalize, or how does she normally walk around? If you have someone with you, someone will be like your advocate, will be your representative in behalf of you who knows you.
That's why it's necessary to have a next of kin contact on your system, right? Because that we've got someone to ring to.
Yeah.
Yeah.
Just a tip for those who are going abroad. Many countries, UK, Australia, everything in the Philippines as well, they limit visitors.
Yeah.
Especially after the COVID hit.
Yeah.
I think it's when really like not urgent, don't go to hospitals like that. And then sometimes now even they ask you to wear mask if you visit in the hospital, right? So it's just a heads up. Usually one person is allowed in here and in.
It's not a barangay event.
Yeah.
It's not a party.
I think it's a culture thing. You can,
It is. Yeah, I can say it is.
So there are cultures na parang isang buong barangay andoon, and then we always remind them na hindi siya safe kasi nga madaming virus na nakakalat sa hospital. Tapos it's not helpful as well sa ibang pasyente.
I know. Yeah, I get what you're saying. Also, other people should put in their mind, like if there are other like family members in there with only one patient, and then you can also what do you call this? Mai-invade mo din yung privacy ng ibang patients. Kasi 'di ba, hindi lang yung pasyente mo yung nandun, ang daming tao doon. So
I mean, it's not about the quantity of how many you are in there. It's the quality.
Exactly.
Yung dapat meron kang daming-dami pero di kilala, hindi kayo kasama sa bahay, so hindi nila masabi yung
Hindi
history.
nila alam kung anong iniinom mo na gamot.
Oo,
so, dapat yung dinala mo dun is basically yung alam kung anong nangyayari sa'yo.
You have to make them understand
Yeah.
na lang. And then, like I said, it goes with the culture. And usually, parang 2 visitors, no? Parang 2 visitors lang siya. Especially in the wards, they're more strict. They have visiting hours. But in ED,
There's
all day.
Yeah.
All day, but only limited visitors. So, going back to just bringing a body, there's an exception for it. So, kung palliating ang patient or hospice going, alam mo na yung saan siya papunta, yung parang mamamatay na, or someone who usually, yung may mga cancer, parang terminal cancer or newly diagnosed cancer, usually.
There are considerations basically.
Madami yan. So, you should know as well when na lang to tell them. Because you have to put yourself into their shoes. If their family member is like newly diagnosed or has a very bad type of cancer, parang gusto nila mag-spend time, so you'll have to, because I had that before. The patients get like 5, tapos the cubicles are not that big. But then I had to read the history. She's like terminal metastatic breast cancer. So I had to consider, di ba?
I know, I remember, we have to like someone that really prioritize, but somehow give them space where their families can, be with the loved one when they are on this kind of situation. But
Kaya sa UK, we have a cubicle specifically for palliated patients.
Cubicle H.
Cubicle H. And we put them there. At saka yung ilaw, parang kukunin.
may ano ba yun? May clouds.
May clouds pa. Ganon. They value it so much na merong trolley for palliating patients. May mga binibigay pa na mga, di ba, crocheted na hearts. They really value, which I think is good. And I think if kaya man lang ng ibang countries to do it, they should do it, no? Because I think it's just being empathetic and like showing care, especially to those families who are under
this kind of situation.
Yeah,
that's true. So the next one will be your pack your essentials. Just basic stuff like, if you're using glasses, your hearing aids, chargers, diapers if you've got a baby. So in the emergency room, time moves quite differently.
Yeah, it's different.
Suddenly you arrive in the emergency, it's just 3 p.m. and when you check the time, it was already 6 p.m. So mabilis masyado yung oras doon kasi nga very fast-paced yung emergency department.
And always treat like if you go to the ER, treat it as like a surprise flight, long haul flight, because you don't know when you'll be discharged. So you better be ready. That's sorry. Sometimes they will say, "Oh, I didn't even pack this." So in abroad, especially in here, patients the waiting time for
it's very
long.
You can be in emergency department 13 hours, 20 hours.
It's normal. It's normal. It's nothing that new. Kasi sa Philippines, we compare. You don't go to emergency if you don't have money. So it won't be as long as you are quickly seen there as long as may pambayad.
Because that's paid. So you've got what you paid for.
Yeah.
Unlike so you're na libre. So maghintay ka kasi libre lang.
Kaya nga eh. So the essentials that you have on your hospital pack will make your life easier and comfortable. But it doesn't mean you're gonna agree with me with this. You have to bring all your cases and suitcases. Oh my God.
Not unless maybe if you're having a baby or one,
I'll give you that excuse. But if you're like bringing 2
trolleys.
I was like, where are you going? Are you going on a vacation? But some of these patients, parang sanay na sila. Tapos sabi nila,
like parang they know what to expect na parang, andito na naman ako, 3 days na naman ako dito.
Long flight nga naman.
That's acceptable if you're like, chronic patients na, alam mo yun.
Pero pag parang dahil sa tummy ache or dahil lang sa shortness of breath na normally fit and well ka naman, you don't have to bring all of those things. You're lucky if you can ask someone to bring you. Pero yung ay na-accept lang namin yung matatandang madaming suitcases, that's it. Because they're very cute. They will change their gown, like, I want to change to my night gown. Oh my gosh, ang cute. So, hindi ka makakaindi, di ba?
Totoo, So just bring your essentials, everything that could make you comfortable in the emergency department.
Because it's gonna be long, baby.
Yeah, it is. Also, if you're like, using any machines at home, like any CPAP, especially for yung mga may sleep apnea natin na patients, just bring it, ano pa ba? Just bring your whole house. No, I'm just kidding. So next one will be, when you present to the emergency, when you're feeling something, if you cannot remember, try to write it down. Make a diary of your symptoms or the timeline, when it started, what makes it worse, what makes it better. Because if you're in the emergency department, history really matters. Like, even like, we've mentioned before, like for example, may mga stroke ka, yung mga onset ng symptoms, it's necessary if you document everything. And it just helps the medical professional.
Yeah, true. And also the doctors, they rely heavily on what you say to them.
True.
So being organized, clear, it will help them. Kasi how many times I seen na yung patient parang okay na sana for discharge, tapos biglang nasasabi, ay no, isang alaw pala, did ka. Or tumaya ako ng dugo. So another problem. So if you say it earlier, the doctors can do some tests and make sure that you can go home with a peace of mind.
And
diba?
there will be no delayed in care, yung sana nagawa na, dapat na CT ka na, hindi pala. Kasi yun, may mga
ngayon mo lang
na-miss out
sinabi,
ka.
I mean, you're human. You can, but like she said, if you write it down, if you're forgetful, or if sometimes you're, when you're in hospital, sometimes you forget what to say.
Exactly.
While waiting in the waiting room, write it down, type it in your phone, and then say to even the key points. Because it's better if you ask someone, oh, are you in pain? I'm in pain everywhere. So it's so hard to, pinpoint which test should we do. Yeah.
We cannot do scans or x-rays everywhere, guys.
Compare it with saying like, oh, I'm having pain in my right flank area, and it's been there for a few days. It's like sharp. So it's really good, no?
Because right detail can give you at least the right treatment, basically.
Yeah, true. Faster.
The faster.
Yeah, the faster the better always. So, another thing to bring when you go to an emergency department is your patience. A whole lot of it.
Put it on your bag as well.
A big bag. Because emergency rooms everywhere have what we call triage. And it's like prioritizing patients according to their need. So, if you're stable enough, you will wait.
Yeah, it depends on your category.
Yeah. The patients who are short of breath, who are bleeding, who is having a cardiac arrest will always go first. It's just a rule. Like, syempre unahin namin yung mga poorly, parang ano naman, di ba? We treat the ones who need immediate attention first.
Yeah.
No?
It's sad, but you need to accept the fact that if you're unwell, you'll be if someone is unwell, we will prioritize them. That's why in the emergency department, we always inform the patient or someone booking it, like, this is the waiting time. At least you inform them ahead of time what to expect. Because it's sad na, yun nga, even me, like, if I'm gonna be sat in the waiting area at 17 hours, I'm gonna be fed up.
Yeah,
better go home. But you have to, also think about what's going on inside the emergency department. It's not just because you saw the nurses sat in the triage, nothing's going on.
Yeah.
Believe me, there's a lot going on at the
Maybe
background.
that's the first time we sat in a 12-hour shift. Anyways, this is where taking painkillers comes in, because waiting while you're in pain is different from waiting that you're comfortable.
Exactly.
Those who are waiting in pain are the ones who usually kick off and get angry sa mga nurses. Kasi nga, we've been waiting hours and all that. So, if you're in pain, tell the nurse. Yeah, take something. Or if you're already in hospital, tell the nurse, because we're happy to give everyone.
Yeah, I was also about to say, be patient when coming to ED doesn't only come with the waiting times. It also means be patient with the system, be patient with the people around you, like especially the nurses or the doctors.
Yeah.
Because, as what I've mentioned, marami kaming ginagawa. We're not like office girls na nakaupo lang sa desk. It's not like that.
True.
Getting a narcotic takes a while, but other patients like, why did you take some time to get, my endo.
Because we have to do double check.
You have to get the
yeah.
keys, look for the keys, double checks,
There's a
prescription.
process. There's
So
a process.
yeah, unlike it's just paracetamol, I can just get it from my
True,
pocket and
true,
give it
true,
to you.
true.
But there
Yeah.
are lots of process going on. Like maybe you will just see a nurse who's walking past you in the waiting room. Oh, the nurse is just walking there, not minding me.
Yeah.
But maybe you don't know he's looking for a mental health who just absconded somewhere.
Yeah, true.
You know,
There's so many
there are
things
lots
that
of
you have
going on. So be patient with everyone in the
Yeah.
hospital.
I think to avoid boredom, it's usually boredom. You have to prepare yourself mentally, bring something to occupy your time. I can see old people like reading books, which I think is very cute.
Yeah.
Because they're the ones who's really patient. They read books, and some of them watch movies. And to just remind yourself that if you're waiting, meaning you're not the sickest person in the department, which I think is a good thing.
Yeah.
Which I think that you're lucky to be sitting in there and not wailing for pain or not catching your breath.
Yeah, that's
So
true.
just prepare yourself and prepare yourself and also prepare things to do. If you're not really, if you're really stable, like you've just been there because you're worried about something.
Yeah, and if you think you're really not that sick and someone needs to be seen before you can talk to yourself like, maybe do I really need to be in emergency department?
I was gonna say, oh my
Maybe I'll
gosh.
just have to see my GP, or you can just approach us in the desk like, I'm feeling better, am I all right? So, because we can help you, we can assist you, we can suggest like if you need to go or you need to wait,
We can
simple
give
stuff.
our
medical
no opinion. There's a term for it. Intelligent opinion? Was it something like that?
Yeah.
We can give you our
professional
opinion, or how you say it, about these things, but always the decision comes to, like, it boils down to you. What do you think? Because only you can tell yourself, nah, I'm not really well, or I think I'm okay.
Yeah.
So yeah, those are the things that you should bring. I think that's the most important. I'm kidding. So the last and final thing, this is an extra add-on, is to bring your personal aids or any essential kits or essential aids that you have, such as maybe if you have like walking sticks,
mobility aids,
hearing aids is very important. There are a lot of patients that we struggle to assess because they can't hear properly because they left their hearing aid. So it's very important that you bring it with you. Also, I think, what else do you think?
Anything that could basically provide comfort with you. I mean,
Support.
oo.
Yeah.
As what we've mentioned, if anything, like for example, due to long waiting times, get something to read. If you can crochet, you can crochet in the ED if
I've
you
seen
want.
someone crochet.
Yeah. Snacks.
Yes, snacks.
Because not all emergency, as we've mentioned, provide food, especially in the waiting area.
We only have sandwich in A&E and some cup of juice.
Yeah, so whatever can provide you comfort and also your relative, anything that can ease your pain, you know. What else?
I think also dentures. Bless
You
those.
cannot eat snacks if you don't have your dentures.
Especially for elderly patients, no? They have their dentures, any prosthesis that they have. And also, I think you can bring, it's not a part of your body, but you can bring your previous imaging. Because especially in Australia, they have private na hospitals. The results are not
compiled into one.
They cannot be accessed by the public health. So if you have it with you, usually it's in a paper, there's a CD. Bring it with you. It will be really, really helpful for the doctors. Your advance directives, if you have,
if you've got any special power of attorney,
bring it with you.
Anything that can be related to your medical problem that you're presenting in the
bring it with you
department.
It's more helpful than really not bringing anything.
Than being empty-handed when you present yourself to the emergency.
Yes. So I think that's it.
That's it.
So those are the 10 things that you should do or bring with you before you come to the emergency department. They sound simple, but they really make a huge difference. Not only for your safety, but for the staff and for the quality of care that you receive in the hospital. So for us nurses applying abroad, these are the kind of practical lessons that shows how prepared you are to work in a global healthcare system. It just gives you a glimpse, on how it works and what things we should prepare, not only as a nurse but also as patients.
Exactly. So yeah, just think of it this way. Every emergency visit is not just about treatment, it's also about preparation.
Yes.
The more prepared you are, the less problems that you will encounter. If you like present yourself in the emergency department and then you've got everything all in hand, you're not just helping yourself, but you're also helping us, a medical professional, looking after you.
Yeah. Thank you so much for tuning in or watching our videos here in Scrub Mentality. We hope that you find this very helpful. Please share it with your family, your friends, your fellow nurses who's planning or dreaming to work abroad. And let us know in the comments below if there's anything that you want us to talk about.
Yeah.
And what we should tackle next.
Yeah. And also remember, when you come to the emergency department, be prepared. Don't panic. Emergency department is already as stressful. So
Calm down, breathe.
Just calm down. Let everything be a smooth process all throughout.
Yeah.
Don't forget to
Like
share our
and
channel,
subscribe
please.
and like our channel because it's our blood and bread and butter us because we want to cut our hours.
Yes, you need to help us cut our hours.
We want to be stay-at-home mom. Thank you so much, guys. I hope you enjoyed this video as much as we did. We can't wait for the next one.
Bye.
Bye-bye.